Right. So the set of case notes that we are dealing with today are for the patient Michael White. Mike's on mute, please. Thank you. When we get the case notes, along with the case notes, you have a writing task. So the first thing that you're doing when you get the case notes is look for the writing task, which usually is at the end of the case note, but can also be in the beginning. So identify the recipient's details and the purpose of writing from the writing task, and then start reading the case notes from the beginning. The purpose mostly is given in the writing task, but sometimes it's not there. So we read the information just above the writing task, or we read the whole set of case notes to find out what's the reason that this letter is being written. It's very important that you find out the information about the recipient and the purpose, because only then will you be able to identify the information that you need to include in the letter. So, or the language that you're going to use in the letter, or the organization of information. So in order to be able to write the letter, these two pieces of information are very important. When you're reading the case notes, number one, you're not talking. Mohali, can we stop that? Mohali students, can we stop talking? Yeah, thank you. That would be great. Right. So when we're reading the case notes, please keep in mind that you are not allowed to write anything on the case notes, underline anything, or highlight anything in the first 5 minutes of time. But after the 5 minutes, you can write anything, mark anything. So drop your pencils and read the case notes and understand the situation of the patient very clearly. I'm setting the timer for 5 minutes, and your 5 minutes to read the case notes begin now. Please read the case notes, everyone. All right, the 5 minutes of reading time are up. Have you all read the case notes? Okay, how do you find them today?
Easy, ma'am.
Easy, ma'am.
Easy for Ramveer, easy for some of us. Easy. How are they, Poonam? Okay. And Mohali, how are the case notes? Very nice. So for reading, it's good. For writing, it's not good, but it's the writing test, not the reading one. So the writing needs to be good. Okay, I got that. And Delhi, how are they for you? Easy. Oh, most of you find them easy. I thought otherwise, but that's great. Okay, now that you've read the case notes, my first question is, what type of a letter is this? Mohali, mute. What type of a letter is it? Is it a referral letter, a transfer letter, or a discharge letter?
Referral letter.
Referral letter, transfer letter. It's both. Referral letter because you are writing to introduce this patient to the recipient. The recipient does not know the patient already. So whenever you're writing to inform the recipient about the patient for the very first time, it becomes a referral letter. Stop talking, Delhi. So that makes it a referral letter. Also a transfer letter, because now you are transferring the care from your hands to somebody else's hands. From your facility to somebody else's facility, you're sending the patient so that the patient can receive care. So it's both a referral and a transfer letter. Not a discharge letter. Why?
Because patient is not admit, ma'am.
Right. The patient was not admitted, is not getting discharged. The patient just visited the general practitioner's clinic. So it cannot be a discharge letter. Very good. Now let's read the writing task. It says, using the information in the case notes, write a letter to the surgical nurse, Georgia Surgical Hospital at 27 Station Road, Brisbane, including details of your pre-procedure assessment, and nursing management. The question would be for, let's say, Preeti in Mohali. Preeti, to whom are you writing the letter? Who is the recipient? Who is going to read this letter? Yeah, Preeti, we are writing to a surgical nurse. Is the name of the surgical nurse given to us? No. Everyone's name is Preeti now? No. So Preeti will answer. The name of the recipient is not given. We just have the job role, and that job role is that we are writing to a surgical nurse. So when the name of the recipient is not given, which article do we add to the job role in order to specify to whom we are writing?
Faithfully.
Article. Which
The,
article?
ma'am.
The is the article that you will add to surgical nurse in order to specify, because there is a definite article. She'll specify that is the particular surgical nurse to whom the letter is being written. So on the top left-hand side of your letter, the surgical nurse, next line, Georgia Surgical Hospital, next line, 27 Station Road, next line, Brisbane. You're not going to put a comma in each line because you're already moving to the next line. So these are the details of the recipient. The second thing that we are trying to find out from the writing task is what's the purpose of writing. But before going to the purpose, do we need to know what would be the job role of a surgical nurse? Yes, very much. Because depending on that, you would be selecting the information. So let's understand what's the job role of a surgical nurse. Whoever knows will raise their hand. Some of you are already surgical nurses, so whoever knows what a surgical nurse does, can you raise your hands? Great. So, can you help us? What does a surgical nurse do?
Surgical nurse takes care of the patient during surgery, pre-surgery, and
Very
also post-surgery.
Very
This
good.
total time duration takes care of the patient.
Absolutely. So whenever a patient undergoes a procedure, the procedure can be a surgery or something similar to a surgery. So whenever a patient undergoes a procedure, Delhi girls, Christmas parties later, not now in the class. So whenever the patient requires any procedure, for that procedure, a nurse is always involved. The nurse will not be performing the surgery, but the nurse probably will be educating the patient about the surgery, will be taking the vitals and doing all the physical examinations before the surgery, will be assisting the surgeon during the surgery, will be taking care of the patient following the surgery. So every care that the patient requires related to a surgery or a procedure is provided by a surgical nurse. And is surgical nurse a specialist? Yes, they
Yes,
are.
ma'am.
They're not general nurses. They only deal with the care of the patients who are involved with any kind of surgical procedure. Right? Yeah. Okay. Right. So we are writing to a surgical nurse. That clearly means that a patient probably is undergoing some procedure because of which they would require care. The purpose of writing, is it mentioned in the writing task?
No.
ma'am.
The
No,
purpose
ma'am.
is not at all mentioned in the writing task. The letter says you have to include the details of your pre-procedure assessment and nursing management, which means whatever assessment you did and whatever management you provided to the patient, you're going to include the details of that. But have they mentioned what do you want from the recipient? No.
No.
Have they mentioned why you have to give this information?
Because patient.
No. So is the purpose of, where is it mentioned? It's not mentioned in the writing task. The task does not have any information about the purpose. The task just mentions that you have to give this information about the patient. But why that information is to be given, that's not there in the writing task. So when the purpose is not given in the writing task, where do we go to find out the purpose?
Topmost of the letter.
Discharge plan your whole.
In the information just above the writing task. And in this case notes, the information just above the writing task is the follow-up, which includes R/V. What's R/V for?
Review.
Good. Review of the patient post-procedure with doctor and nurse. Then further counseling and tests will depend on the result of the colonoscopy. send a letter to day procedure nurse. Out of these three, which one will be a request for our recipient?
Nothing.
Nothing at all. Because the post-procedure review that is to be done by the doctor and nurse will be done by which doctor and which nurse?
GP.
No, the surgical nurse is not going to do that.
Who's writing the letter?
The nurse who is writing the letter, because the nurse who is
And
writing the
GP.
letter works for a GP. So this GP and this nurse are going to review the patient after the procedure is done. Second, the result of the colonoscopy will determine what further counseling will the patient require or what further tests the patient will require. Will the recipient have anything to do in this counseling or tests that other
No,
tests?
ma'am. No.
No, ma'am.
Ma'am, GP.
No. And then finally, send letter to day procedure nurse. Who is going to send this letter?
Me.
You.
Nurse,
the person who is writing the
GP
letter.
nurse.
And who is a day procedure nurse? The
Surgical nurse.
Surgical
Nurse, ma'am.
Writing. Now, who is a day procedure nurse? A nurse who is involved in the care of the patients who come for day procedures. What are day procedures? Procedures for which the patient does not require overnight admission. They come in the morning, get the procedure done, go back in the evening. They're not admitted in the hospital overnight. And such procedures, are they major procedures or minor ones? Absolutely.
Minor, ma'am.
Minor ones, because if there would be major procedures, then the patient will have to be there in the hospital for post-op care. But if the patient is going back on the same day, that means these are minor procedures. So none of these things are for the recipient to do. Most of these things are being done by you. So is the purpose mentioned here?
No, ma'am.
No, again, it's not mentioned. What do we want? Sorry, what surroundings of the patient? Which surrounding of the procedure? Sorry, they can. Is it mentioned in the follow-up or the plan here? No, it's not mentioned. That is our guess. So the purpose is still not mentioned in the writing task, which means we'll have to read the whole set of case notes to find out what's the reason that the letter is being written. But do we know for which procedure the patient is being sent to the recipient?
No.
Yes, ma'am. Colonoscopy.
It's mentioned here in the follow-up that the patient is going for colonoscopy. I'll ask for more information about this when we read the case notes. So, should you panic that the purpose is not there in the writing task and in the follow-up?
No.
No, ma'am.
Will you panic? Yes, you will. I'm sure. Yes, you will panic. You should not, but you will definitely on the test day. So why should you not
Yes.
panic? Because the information can be given in the whole set of case notes. So let's read the whole set of case notes to find out the purpose. You are a nurse for a general practitioner. Mic's on mute. You are a nurse for a general practitioner and a patient is going to have a day colonoscopy procedure in the hospital next week on 10th of June 2018. You are attending the patient for the first time. So who is writing the letter? A nurse is writing the letter. And where does this nurse work? This nurse works for a general practitioner. Who is the general practitioner?
Who is, ma'am, send the patient to specialist?
No.
Who is first priority?
GP is the short form of general practitioner. My question is, who is the general practitioner?
Physician.
Okay. Answer in yes or no. I will also give you information like this only from now on. When you ask me questions, I'll give you acronyms. And then I'll see if you understand. Is general practitioner a doctor?
Yes, ma'am.
Yes, ma'am.
Absolutely.
Yes, ma'am.
They specialize in any care?
No,
Specialize?
ma'am.
No.
No, ma'am.
No.
No.
They do not specialize. They manage all the general conditions of the patient. But are they the first point of contact for the patient?
Yes, ma'am.
Yes.
Yes, ma'am.
So if a patient has any kind of health
Yes,
condition,
ma'am.
Absolutely. So if they have any kind of health condition, they would contact the doctor first. Then according to the condition of the doctor, condition of the patient, the doctor is going to send the patient to different specialists. So the patient has come to a general practitioner. It's mentioned that you are attending the patient for the first time. It's not that the patient is your regular patient. He's come to the general practitioner for the first time. These are the two pieces of information that we... Sazia, be on mute. These are the two pieces of information that we have about the situation, along with the information that the patient is going to have a day colonoscopy in a hospital next week. And the colonoscopy is scheduled on 10th of June 2018. Now let's understand what's colonoscopy. Kiran, can you help us? What is it?
Examine of colon, ma'am.
Kiran, wait. This Kiran is answering actually. There are two Kirans. So this Kiran number will answer. Yes. Absolutely. Right. So it's a diagnostic procedure, number one. Number two, this procedure helps in understanding the problems related to the colon. Number three, in this diagnostic procedure, the camera or whatever that device is called in your term, is inserted into the patient's colon through the rectum, so that the doctors can visualize the colon properly to identify if there is any problem in the colon or not. Was that the correct definition? I know it's very late.
Yes, ma'am.
Not what you
Yes,
learn in
ma'am.
the nursing courses, but this is what I learned from Google. So yeah, thank you for adding to that, Kiran. So the patient is going for this procedure to the hospital next week. Patient details: Mr. Michael White. His date of birth is 5th of February 1956. His next of kin. That means the person responsible for taking his life and death decisions is his sister, whose contact number is given to us. Our patient is single, he is not married. Today's date, that is the date of writing this letter, is 3rd June 2018. Presenting issue: why has the patient come to the general practitioner? The patient says that my colon cancer scan result is positive and I want colonoscopy. Colon cancer scan, is this the primary test done to find out if the patient has colon cancer? Yes or no?
Yes, ma'am.
Yes, ma'am.
The
Yes,
first
ma'am.
test that is performed to find out if the patient has cancer. If the result is positive, does that definitely mean that the patient has cancer?
No,
No,
ma'am.
ma'am.
So in order to confirm if the patient has cancer or not, there is another procedure that's required, diagnostic procedure, and that's colonoscopy. So the patient has himself come and said that this is my report, it's positive for colon cancer, I want colonoscopy. The patient cannot directly go to the hospital and request for colonoscopy because the patient is not in India. Social background: our patient lives alone in a large house. He's a full-time worker. His hobbies include cycling. His grandfather died of colon cancer in 2005, and his father was diagnosed with bowel cancer in 1996, for which the father underwent a resection. So can we say that he has a positive family history of colon cancer, of
ma'am.
cancer in his
Yes, ma'am.
father
Yes,
and
ma'am.
grandfather?
Yes,
Right.
ma'am.
So that's true. Any questions on the first page? Anything that was not clear?
No, ma'am.
No, ma'am.
Second page, medical background. In 2013, he had some bowel issues. Probably he had constipation because of poor diet, being overweight, eating fast food, drinking and smoking heavily. The question mark here is for probability, not certainty. Whenever you have a question mark in your case note, it means possibly, probably the patient had it. In 2014, the patient had cold, flu, and runny nose. And in 2015, he had headaches, fever, he was tired, he had lethargy, and he was fatigued. Lethargy? What's that? No.
Tiredness.
Lethargy is a mixture of laziness
Lazy.
Lazy.
Lethargy is what you always have in this class, the last class. The laziness to respond to your teacher. That's lethargy. But let's say if you've worked very hard and then you fail to answer, that is tiredness, that is fatigue. But your laziness because of having heavy lunch and not responding is what is lethargy. So a patient had all of that in 2015. Medications that a patient is on is paracetamol occasionally. We learned occasionally yesterday. What is it?
Sometimes.
Sometimes, not
Unnecessary,
always, on and off. Sometimes he
Regular.
takes, sometimes he does not take. So the synonyms of occasionally could be irregularly, could be sporadically. So a patient takes paracetamol and ibuprofen rarely. What's rarely?
Not common. Like
Very few times. Not much, very few times. Probably once in a year or twice.
Paracetamol not works, then she takes ibuprofen.
That is what you're saying as a nurse. That is not what the notes mentioned. So yeah, that's what a patient does. And why does he take it? For pain and swelling in his left lower leg. Probably he has some problem there. He does not have any known allergies. This no known allergies can be written in your case notes. Mike's on mute.
No, ma'am.
Yeah, this no known allergies can sometimes be written in your case notes as NKA. So be very careful about that. And he has sensitivity to codeine. Just please, what is codeine?
Antiseptic solution, ma'am, for cleaning the wound.
Betadine.
And tablet, ma'am. Sedative tablet.
Medicine, ma'am.
tablet.
Ma'am, betadine.
Medicine.
No,
Codeine,
betadine.
sedative tablet, ma'am.
Ma'am, it's giving
it's cough
to
syrup.
for cough syrup, ma'am.
Cough syrups, ma'am.
Stop. Everyone stop. Whoever knows the answer, raise their hand. It's not. Yes, thank you for that. It's an opioid. It
Yes.
is not antiseptic. It is not betadine. Betadine is antiseptic. It's very different from betadine.
It's okay.
The codeine is an opioid, which is usually given as for pain relief or as a sedative.
Yeah.
So our patient has sensitivity to codeine. Manorama, did you have the same answer?
Yes, ma'am.
Thank you. Okay, right. So this is what is the history of the patient as far as medicine and medical conditions are concerned. On 3rd of January, today, he came to the doctor, the general practitioner, for a consultation. During the consultation, he admitted changing bowel patterns and that his bowel test result is abnormal. He said that my bowel pattern is now changing. Probably the passing of the feces is not the same. And that my bowel cancer scan result is positive. He's worried because his family history is positive for cancer. And then he said, I want a colonoscopy. So what did the doctor do? The doctor ordered some tests and said that we will review your condition after the procedure. That is the colonoscopy. Nursing notes. So first the patient was consulted by the doctor and then you, the nurse who works for the doctor, talked to the patient and took some information. First, you took the vitals in which you found that the respiratory rate is 22, heart rate 77, BP 145 by 85, and the SpO2 level, oxygen level 97% on RA. RA is room air. Height of the patient is 175 centimeters, weight is 80 kgs. Anything that's not okay in the vitals and the height and weight?
Slight elevation in BP.
BP is slightly elevated and probably the patient is a little overweight. I'm not certain very overweight because he's tall enough. He's 175.
According
So yeah, he would have
to
that
age, ma'am,
muscle.
it's normal.
Yeah. And also he would have that muscle weight because he's tall. So probably a little overweight, but then that's okay. But the BP is slightly elevated. Pathology results, FBE, UEC, and REC will be available. I mean, pre-procedure. Pre-procedure is before the colonoscopy is to be done. FBE, I don't know. What is it? Full. Oh, Mohali and Delhi are
Blood examination.
absolutely.
Full
Mandeep.
blood examination.
Yeah, absolutely correct. All of you, I'll just pause for a bit. Right. So as your friends mentioned, Mohali and Delhi, you got disconnected. FBE is full blood examination. UEC,
Urine examination.
urea electrolyte and creatinine examination. REC, I don't know this one. You will have to help me. You are nurses, I am not. REC, what is it? Google and help me. I don't know this one. Nurses, I did not expect this from you. I thought you would help me.
Ma'am, it's not a regular term.
It's not a regular term. Then what is it for?
Mm.
Okay, whatever Adil said, that it is. I don't know what is it. I don't want to know what it is. Because I am not going to
Maybe
be.
rectal examination.
You are all nurses. Sorry, Seema, you were saying something.
I think maybe rectal examination related. Rectal examination.
It's related to kidneys, renal epithelial cells. This is what they said. So for whoever
Because
does
they
not
are
know, yeah, probably you can save it because this is going to help you in your CBT exam after OET. So yeah, learn it. The FBE, UEC and REC tests were done and the results will be available before the colonoscopy, and the patient needs to avoid smoking and alcohol consumption. On the next page, we have the information that he was anesthetized earlier, but there were no issues that he had. And he has now been told that he would not require a lot of amount of anesthetics, so he need not be worrying about it. Then we have more information about the nursing notes that you made. Number one, the patient has already arranged for the transport for day procedure because probably he'll be under sedation.
Light sedation.
Yeah, he might not be able to drive back after the procedure, so he's arranged the transportation. Then the second point is he does not have any allergies, but he's sensitive to codeine. And can codeine be used as a sedative in such procedures?
Yes,
Yes, it
morphine.
can be. Right, it can be. So an alert band is attached to the letter, and the recipient is also to alert and inform the other staff who will be involved in the procedure. The patient has signed the consent form. He's given the permission. Obviously, he would because he's the one who requested for the procedure. Then we have the information that he has been told that he has to strictly fast since midnight, a day before the procedure, and he has to take light breakfast the day before the procedure, and then only thin fluids. So what will happen? The procedure is on 10th. So on 9th, the patient is to take light breakfast, then only light fluids or thin fluids, following which from midnight, he is not to eat anything. Why so? Why the dietary preparation?
To clear the
To clear
bowel.
the colon
Colon, yes, ma'am.
for better
Right.
examination and
Right.
The
results.
So that the
visualization of
bowel,
the images.
so that the bowel is free of any kind of fecal material, so that the patient, the recipient, the doctor who will be performing the procedure can have a clear access to the colon. Along with the dietary preparation, the patient has been instructed about bowel preparation, for which he needs to use pre-kit C 2 days prior to the procedure. Again, this is a kit which helps in clearing of the bowel, and the patient is to use it 2 days before the procedure. Yes, somebody said, ma'am. Okay, you just like saying ma'am. Okay, the patient has also been given brochure. What's a brochure?
Where the information is
Leaflet.
provided.
Leaflet, ma'am.
It
A
contains all
Page of
leaflet,
it,
a
ma'am.
booklet, a pamphlet.
Written,
So the
written
all about the
information.
procedure.
right. So a booklet, a pamphlet, or a leaflet which has written information about things. In this case, the brochure that has been given explains the procedure, the possible results of the procedure, the risks that can be there with the procedure, and what to expect before and after the procedure, along with any complications or side effects. The patient has also been told that he will not require a lot of amount of anesthetics, and has also been informed about the importance of balanced diet and exercise. Now we have read the whole set of case notes. Do we know what's the purpose? Mhm.
Yes, ma'am.
Further evaluation.
Thinking about something? Right. So this is an informatory letter. Why are we saying it's an informatory letter? Because the colonoscopy that the patient is to undergo has already been scheduled. You don't want the recipient to schedule it. Number two, whatever the patient needs to know before the procedure has also been informed. So, why are you writing the letter? You are writing the letter to inform this recipient about the care that you have provided to the patient so that the recipient, when they're performing the surgery, they are aware of all the situations that this patient has. So what's the story of our patient? He came to you. He said that I need colonoscopy. I have positive history. I have positive scan results. And you have scheduled that colonoscopy in a hospital. And you have also prepared the patient or given the information to the patient about the preparation. You are writing to inform the recipient about this patient. So you are writing to introduce this patient to the recipient. You're not writing to request anything. You are not expecting something from the recipient except for the procedure of the patient be performed. And that scheduling of the procedure has already happened. So you cannot request colonoscopy, you cannot request monitoring, you cannot request a specific kind of care because nothing of that sort is mentioned here. So this is an informatory letter in which you're writing to inform about the patient to the recipient or in which you're writing to introduce this patient to the recipient. Do I make sense?
Yes, ma'am.
So,
Yes, ma'am.
yeah, so sometimes it might happen that you're not requesting anything for the patient. Be very careful in the examination, don't be confused. There can be chances that you're not writing to request anything, but just writing to inform about the patient. Now, please have a look at the whole set of case notes. If there's anything that's not clear, you may raise your hands and we can discuss. Yes, Ruben. Thomas, check your mic, please. Yes, Ruben, your question.
Yes, ma'am. My question is, in the situation where you are informing your colleague, maybe of the same institution, maybe the different is the department, but it's the same hospital where you're working to. Are you going to use the address there on the citation of the address? Salutations.
Yes, in the recipient's details, we'll put the information and the address, Ruben. But in the sender's details, we don't have to repeat this information. In the sender's details, we are not going to write the address of the sender if they're of the same facility. In that case, we're just going to write, for example, your sincerely charge nurse or the name of the department, let's say surgical ward, but not the name of the hospital because it's the same hospital that they work in.
Thank you very much, ma'am. Thank you.
You're welcome.
Excuse
Anybody
me,
else?
ma'am.
Yes, Adil, your question. Okay. Yes. Why do we want that information? Why should we seek any information related to the procedure? Uh-huh. Right. Right. we are not expecting anything from the surgical nurse. We are actually facilitating the surgical nurse's information. Let's say you are the surgical nurse who is going to perform the procedure of, or who is going to assist the doctor to perform the procedure of this patient. Would you need some information about the patient? Yes. So this letter is to inform you about this patient. Right. Are you seeking something in this set of case notes? Do you want something from the recipient? Is it mentioned? Right. So in the case notes, they would always mention if there is something that's needed from the recipient. So if you go to yesterday's case notes, you will find information about the things that you want from the recipient clearly mentioned in the task. So it would always be mentioned in the case notes if there is anything that is to be sought from the recipient. In this case, nothing is being sought. That's the reason we are writing to provide something. And what are we providing? Yes, this letter is to inform or provide information to the recipient. Yeah. You're welcome. Yes, Kajal, any issues? No. Okay, okay. I thought there was some problem. Okay, thank you. Right. Now that the case notes are clear, let's mark the relevant information. You will all have 3 minutes of time individually, during which you'll put a tick against everything that's to be included in the letter and a cross against everything that's not to be included in the letter. Make sure that when you're marking the relevant information, you keep the recipient, the purpose, the requests, and the present condition of the patient in mind. So I'm setting the timer for 3 minutes. All of you have 3 minutes to mark the relevant information without talking, and your 3 minutes begin now. Please mark the relevant information, everyone. Do keep in mind the information that the recipient needs to have for the procedure. Read the writing task carefully, tells you what information you need to include in the letter. All right, time up. Have we all read the case notes? Marks the relevant information.
Yes, ma'am.
Okay, then let's start.
Yes, ma'am.
From the writing task, we have to give the information about the recipient so that the letter reaches the recipient. So this information is very relevant. The purpose is not mentioned, so we are not going to mark it here. But the writing task does mention the information that you have to include in the letter. One is the pre-procedure assessment that you have done, and two is the nursing management that you have provided to this patient. So let's now consider that and mark the relevant information. We begin with Rambir. Rambir, from the first sentence, what's relevant and why, what not and why? You are a nurse till first time.
Okay, ma'am. Is a nurse is important,
Mm-hmm.
and the date which scheduled 10/6, and patient name.
Okay.
The procedure also colonoscopy procedure. That will become later also, but not. And the name, patient name, and the date of birth.
Right. Okay. Let's discuss till this point. Since the name of the recipient is not given, in this case, you're going to sign off as yours faithfully. When the name of the recipient is given, then we sign off as yours sincerely. So in this case, yours faithfully, nurse. And yes, that information is relevant because that is to be included towards the end of the letter so that the recipient knows about whom the letter is being written, by whom the letter is being written. Colonoscopy procedure, very relevant that it has already been scheduled on 10th. That is also very relevant because this is the reason why you're writing the letter. Because the colonoscopy is scheduled, you're writing to inform about the patient's condition. You are attending the patients for the first time. That's got nothing to do with the colonoscopy procedure that would be performed. So it's irrelevant. Patient's name and date of birth, very relevant because we'll be putting this information in the subject line or the referral line, RE line, so that the patient's identification becomes easy. Right. Thank you very much, Rambir. We go to, let me see. Akanksha, if you can help us. From next of kin, marital status, both of these pieces of information, what's relevant and why, what not and why?
Ma'am, both are not relevant.
And why would you say so?
Ma'am, because we are writing to a surgical nurse. Ma'am, next of kin might be relevant, like semi-relevant, because in case the procedure is going on and something, some complication arises, she will be the one to be like taking the decisions. So it might be relevant, but the marital status is not relevant.
Will the patient have a life and death situation during the colonoscopy?
Not surely, ma'am, but then, ma'am, it's not relevant.
No, not at all. Because the patient is not in a life and death situation at present, and during the colonoscopy also life and death situation decision will not have to be taken. So this information we need not give. Only when the patient is going to the recipient in a life and death situation and may also die during the care of the recipient, do we include this information. And if he's single, that's got nothing to do with the colonoscopy, so not relevant. Okay.
Ma'am, can I say something?
Yes, you may.
Ma'am, in case of colonoscopy, sometimes doctors needs to take tissue for biopsy during colonoscopy. So that's when we need consent from like someone next to kin. So,
No, in that case, the consent form already has this information.
but
This
that
already,
is for colonoscopy procedure, ma'am, not for biopsy.
but then that information, whenever the colonoscopy, this thing for consent is signed, so me, because there are chances that some tissue might be required to check for biopsy. This permission is also included in that. It's not separate. It's taken already because not suddenly in the procedure will you wake up the patient to take that permission, because there are good chances that cancerous tissues can be found during the colonoscopy. So this permission is included there.
Okay, okay, ma'am.
Yeah. Yes. Mm-hmm. Only and only in life and death situation will the next of kin need that information. Otherwise, the person is otherwise responsible for their own decisions. In this case, do you think the patient will be aggressive? The patient has himself wanted the colonoscopy. I mean, that's a very, I don't know, that's a very imaginative situation, imaginary situation. It's not there in this set of case notes. So I don't think, I mean, if let's say if it is mentioned that the patient is mentally unstable, then probably we'll have to give the next of kin information. In this case, the patient seems to be okay. He himself has requested for the colonoscopy. No, that's a very rare, just a second. So yes, the situation that you were mentioning, it could happen, but it's a rare situation. I don't think it happens every time. No. But that's the worst case scenario that we are having. That's something that we are assuming that this may happen. But this is not going to happen. No, in this case, the chances are not there, and it's not given in the case notes as well. So we are not to assume anything in the case notes. We'll have to stick to what is mentioned here. Yeah. Adil, now you were saying something? No problem. We are highlighting the points that will have to be included in the letter. I don't know. No, we don't know what is needed for the surgery, what is not needed for the surgery, because the assessor is going to assess your letter, Adil, not your ability to perform the surgery. Yes, we'll have to. That is what we are doing. Because the present condition of the patient is that the patient will be undergoing colonoscopy. So whatever information the recipient needs in order to be able to facilitate the performance of colonoscopy will include that. Yeah. Okay. Let's come back to the date of writing the letter and the presenting issue. Let's take the help of Neelu here. Neelu, what do you think is relevant here? Yes. Absolutely. Also, the date of writing would be very relevant. Since the date of writing this letter is 3rd, and this is today's date, it becomes very relevant. And the presenting issue is very relevant because this is the reason why the patient has come to you. And this is the reason why you're sending the patient to the recipient. Because the colon cancer scan result is positive, that's the reason the colonoscopy is being requested. And because the patient wants a colonoscopy, that is the reason it's being requested. So both of them are very relevant because they're the reason why the letter is being written. Social background, Simran, can you help us? Simran online. Social background, what's relevant here and why, what not and why?
Yes, ma'am. The
Ma'am,
family
grandfather
is
died
relevant.
of colon cancer.
Oh, we have two Simrans. Simranjeet Kaur Gill, can you help us?
Yes, ma'am. Ma'am, the family history that the grandfather died of colon cancer, and the father died with the bowel cancer.
The father may be alive. They've not mentioned that he's dead.
Yes,
Right.
ma'am.
So that the patient has a positive family history of colon cancer in grandfather and bowel cancer in father becomes relevant. You don't have to write the years. You don't have to write that the father underwent resection. We are just giving this information because this is the reason why our patient is worried that he might have cancer. And this is the reason why he has requested for colonoscopy. So this becomes very relevant. in the diagnostic procedure. That he lives alone, full-time worker, and his hobbies have got nothing to do with the colonoscopy that he's going to have. Yes, Kiran Meerwal, your question.
Ma'am, we are writing for surgical nurse. So if we write for specialist, general practitioner, so it may be relevant.
What?
Past medical family history, sorry.
Okay.
Father died of colon cancer and father bowel cancer.
Okay, so you're saying this would be relevant for the GP, not for this recipient?
Yes, ma'am. Because of we are writing for surgical nurse for pre-operative care.
Okay, so Kiran, the colonoscopy is being requested or the colonoscopy is scheduled for multiple reasons. Those reasons, primarily there are two. One is why the patient wants it. There are two factors for that. That the patient came with possible positive colon cancer scan result, and two, that the patient has a significant family history. Both of these reasons have pushed the patient to get the colonoscopy done. And since the patient is the one who is requested for the colonoscopy, this information does become relevant for the recipient because colonoscopy is not performed on any and every person. So we'll have to highlight that this is the reason why you have scheduled that colonoscopy at the recipient's facility. Because if you don't have valid reasons, the recipient might also cancel the colonoscopy. It can happen that way. So since you're convincing the recipient why the colonoscopy is needed, you'll have to give this information.
Okay, ma'am. Thank you, ma'am.
You're welcome. Also, the other reason is that this condition is very much related to the patient's present condition, that is the possibility of having colon cancer. Hence, it does become relevant. Okay, let's move on to the next page, which gives information about the medical background. And if I may request somebody from Mohali, only if I remember names. Sandeep's name I remember. Sandeep, medical background, what's relevant and why, what not and why. Sandeep is saying, why does she remember my name and not anyone else? Yes, medical background, Sandeep. What's relevant here? Did the issues of 2013 continue till now? And was there any possibility of colon or bowel cancer then? No, they've mentioned that the patient had constipation, possibly because of poor diet and being overweight. It is not at all associated to the present condition that he has. Yes, he has some change in bowel pattern now, but they've not mentioned that that problem continued for these years. So this is not related to the colonoscopy that we are requesting now. It's not relevant. And 2014 and 15 is not relevant. Stop talking. 2014 and Yachna, if I may request you to be on mute. Yeah, it's not relevant because these symptoms are not at all related to the patient's present condition, so they will not have to be included. Moving on to the medications now. I'll take your questions at the end if you have any. Let's discuss the choice of information so that we conclude the class on time, and then I'll take your questions related to the information that we have found. Dipali, if you can help us with the medications, what's relevant and why, what not and why. Dipali, you're not there?
Yes, ma'am.
Yeah.
Ma'am, paracetamol occasionally. Ibuprofen rarely.
Okay.
Or and ma'am, sensitive to codeine.
Codeine it is, yeah.
Codeine.
Right. Now, for the first point, paracetamol and ibuprofen, I have reasons for both. Some of you in the past classes mentioned that it's relevant and some said it's not relevant. Why do you think it's relevant? Because these medications can very much interfere with such procedures that are being performed. So the performing doctor always requires the information about the current medications of the patient. And since our patient takes these, we'll have to inform. But there are good chances of not including this information because our patient takes this occasionally and rarely. But again, I have one more point of why it should be included, because we don't know when the patient last took it or when the patient is going to take it again. since this is a usual medicine of our patient, we'll have to inform the recipient that this is what she takes, so that when the procedure is performed, the nurse can herself check when the patient last took it and accordingly inform the doctor who is performing the surgery. Hence, this information becomes relevant. Sensitivity to codeine, I don't need to give the reason. You all know that codeine can very well be used. My phone's on mute, please. So sensitivity to codeine can very well be used in the procedures as sedative. So that the recipient does not use it, we'll have to give this information that the patient has sensitivity to codeine. Moving on to the 3rd of June, that is today's consultation with the doctor.
Ma'am,
I'll take the questions at the end, Somi. I'll take the questions at the end. Emil, if I may request you for your help on doctor's consultation, what's relevant here and why, what not and why.
The review is the post-procedure with doctor and nurse.
Sorry, once again, post-procedure review. Okay, you can either pick it up from here or towards the end. It's repeated there. What else?
As you mentioned before, the previous history in colonoscopy and all, that's we can avoid.
Right. So you can either pick up the information about the bowel test scan results and the family history from the previous part of the case notes, or from here. From here, you can pick up the changing bowel patterns that the patient has, and that the patient is worried about the family history. That's the reason he has requested for the colonoscopy to be done, because that's one more factor why the colonoscopy is being requested. Pathology test requested. Either you can write it from here, or you can write the names of the tests. This information is relevant because the recipient needs to know that these tests have already been performed and they will have the information about these tests before the procedure, so that they don't have to do these tests again on the patients to confirm things. The review post-procedure, you can either pick it up from here or towards the end. It's your choice. Nursing notes. Okay, from here I've already marked that the pathology, these tests have already been ordered. Let me see if I remember names. Neha, is she there in Mohali? Yes. Thomas, I'll take the question at the end. Yes, Neha, from the vitals and the height, what's relevant, height and weight, what's relevant and why, what not and why? The height and weight are very relevant. Why should I tell you the why? You are the nurse, I am not. How is the amount of anesthesia counted?
According weight.
According to height and weight, isn't it? Not every person is given the same amount of sedative. So the sedative will be decided on the height and weight of the patient. So that's the reason it becomes very relevant. And the vitals, yes, they're not relevant. Although the BP is a little significant, but the nurse will definitely herself check the vitals before the procedure. These are not the current vitals of the patient. I mean, these will not be the same vitals before the procedure. So the nurse will automatically check it. We don't have to write about it. And that the patient will not require a lot of amount of anesthetics. That's for the recipient to decide. We don't have to give this information. This is what we have told the patient. Moving on to the nursing notes. Now the question is for Parmeet. Parmeet, help us with the nursing notes. I know I've asked you for a lot, but I'll help you through the process. Whatever is relevant, can you help us by informing about that? No. The first point is not relevant. The second one is relevant. Third is not relevant. The fourth one is relevant. Fifth one is relevant. Sixth one is relevant. No, it's not. I'll give you the reason. Then brochure given. You may write this, all the details, or simply write the brochure with all the details has been given, whichever way. And not much anesthetics needed. Importance of balanced diet, not relevant. Now let me give you the reasons. The patient has already arranged for the transport. The recipient will not have to arrange it. So if the recipient will not have to arrange it, why would we write about it? Only if we would want the recipient to arrange it, we will include it. Second, if the patient does not have any allergies, we don't have to write. But yes, sensitivity to codeine, for that the alert band is attached and the recipient needs to inform. Mic's on mute, and the recipient needs to inform all their staff, also becomes relevant. The patient has signed the consent form. Now, this is a point of controversy. Let's discuss it. The reason I don't want it to be included, I have two. One is that the patient has requested for the colonoscopy himself. That itself clearly tells that obviously the consent form would have been signed. And number two, the reason why this information is not relevant is that we have already arranged the colonoscopy. It's not that we are writing to request the recipient to arrange it. If we would request the recipient to arrange it, then they would have to do all this management. But when it is already arranged, there is no management that the recipient will have to do. Now, I know some of you might say that this has to be included because if the consent form is not there, the procedure will not be performed. And you're absolutely, absolutely correct. That would not happen. But in this case, the patient has requested, colonoscopy has already been arranged. So there is no doubt that the consent form would not be signed. That's the reason it becomes irrelevant to inform that, okay, it has been signed. It is automatically understood. Then the third factor, strictly fasting since midnight and diet preparation. So your writing task mentions that you have to give the information about the nursing management that you provided to the patient. So this was included in the nursing management that you provided to the patient. So it's very relevant. Bowel preparation, pre-kit C2. This is again very relevant. You have helped the patient with this. And you have also given a brochure to the patient with all the details. The information that not much anesthetics will be required, that's for the surgical team at the recipient's facility to decide, not you. You have informed the patient about this because you had the information already. And the next point, importance of balanced diet, that would not be concerning the colonoscopy that would be performed. That's for a better lifestyle of the patient, not related to colonoscopy, so not relevant. And the final part, after which I'll take your questions, that the review will be done post-procedure, very relevant, so that the recipient knows that a copy of the results or that the results will determine the further course of action, hence the review needs to be informed, and that the result will determine the further course of action also becomes relevant, because that would indicate that the results of this test are very important, both to the sender of the letter and the patient. Now, one by one, you can raise your hands and then we can discuss the factors that you have questions related to. Listen to your friend's questions as well, because it might happen that your friend has asked the same question, so that we don't waste time later on asking the same question. Listen to your friend's questions as well. We begin with Somi. Somi, go ahead.
Ma'am, in medical history, why didn't we choose no allergy?
Because he does not have any. Only if he would have some allergies, only then we would write about them. No, the only information that we have about his allergies, not exactly allergy, but sensitivity is to codeine. So that it's not used, we'll write about that. If there are no allergies, why would we write about it?
Okay. Okay.
Thomas, you had a question, I guess. You had also raised your hand in between.
No, it's okay, ma'am.
Now it's okay.
Yes.
Anyone else? Okay.
Ma'am, in nursing notes, why it is not important, vitals are not important? Because slight elevation of BP.
Will the patient have the same vitals during or before the procedure? No. And it is very certain that the recipient is going to take the vitals of the patient, because that is what happens in every procedure. The vitals are taken then and there, and accordingly the procedure is performed. So since, and also the vitals was slightly, the BP was slightly high, there could be chances that it is very high when the procedure is happening, or it's normal. So that's for the recipient to take care of, not your concern.
Okay, ma'am. Thank you.
Yes, Parmeet, you're excused now. Parmeet, read it. Parmeet, read it again. Arranged automatically means that this has been done in the past. So arrangement is already done. Yes, Akanksha, your question.
Ma'am, under the heading follow-up, ma'am, why are we including this information further counseling and test? Because the surgical nurse won't do anything about it. Like after the result comes the GP and we will be like advising.
Actually, this kind of tells why it is so significant to have the results of the colonoscopy. This adds to the point why the colonoscopy is being done, because the results of this will decide whether the patient has cancer or not and whatever treatment the patient would need. So we're just informing. Since it's an informatory letter, we are informing on what would be done once the results are available.
So, ma'am, can it be a semi-relevant information?
I would not say semi-relevant. It is relevant, Akanksha. Since it's an informatory letter, it does become relevant.
Okay, ma'am. Thank you.
Okay, then let's discuss the organization. That is the order in which we are going to put this information in the letter. We practiced it yesterday. The same technique you're going to use. I'm not going to help you with that again. Think of the organization that we are going to use in the letter. For all those who are joining the class for the first time, don't worry. You will learn the technique pretty soon. For most of you, you already know the technique. So what information do you think should be included first? What information do you think should be included later? Think about that and let me know what organization should we use here.
Yes, ma'am.
Chronological. Yes, which one do you want?
Chronological,
ma'am.
Hierarchical.
Sorry, Ruben wants hierarchical, others want chronological. Mohali, which one do you want? Chrono, no? That's your favorite. How can you say something else? Delhi, which one? Delhi, which one? They're still discussing. They're in deep discussion. Okay, online students, which one?
Chronological, ma'am.
Chrono, ma'am.
Hierarchical.
Ruben says hierarchical, others say chronological. We'll discuss both of them. Does anyone want to write problem solution manner?
No,
ma'am.
No.
Chronological, ma'am.
Problem solution manner is only used when you're writing about multiple things. In this case, you're just writing about one thing, colonoscopy and all its features. So we will not use problem solution organization. We will either use chronological or hierarchical, and let's discuss why. So chronological organization means that you're giving the information about the events in the order in which they are happening. Whatever happened in the first, whatever happened first is written first, then whatever happens next is written after it, then whatever is to be done in the future is written at the end. It is used in three situations. One, when the patient's past is related to the present. Is the past of the patient related to the present?
Yes, ma'am.
Yes,
Family
Very much related to the present condition. Second, when the past has led to the present. Has the past of the patient led to the present?
Yes, ma'am. Constipation.
Constipation, bowel problem.
No, it's not mentioned that the constipation in 2013 is the reason why he has cancer now. No. So the past has not led to the present. Third, are you writing about multiple visits?
No,
ma'am.
So it's only one factor, that was the first one, that because the patient's past is related to the present, yes, this letter can be written chronologically. Then, hierarchical organization, on the other hand, gives the information in order of importance. Whatever is most important is written first, whatever is less important is written later. In this case, okay, it is used in three situations: when you are writing to a specialist and the information about the specialty be written first and all other things later. So are you writing to a specialist today?
Yes.
Yes, ma'am.
Do you have information related to the specialty and non-specialty? Mostly
Yes,
it is related to the specialty only. But if you think the medicines of the patient that the recipient is not going to administer, so you might consider it to be less important. All others are more important. Then the second factor is when you're sending the patient in an emergency and the past has not led to the present. Are you sending the patient in an emergency?
No, ma'am.
No.
No, ma'am.
And third, do you have something in the letter? Okay, we have a new teacher in the class. Lovely. Siti, if I can request you to be on mute, thank you. Right, and the third factor is when something in the case notes is more important than other things. What do you think is more important for this recipient to know as compared to other things?
Everything is
Yes,
important
ma'am.
here.
But ma'am,
Writing task.
but ma'am, information is more important than family history.
No, family history is the most important information. Yeah. The most important information in this case is the assessment and the management that you've done for the patient. And this is more important as compared to the patient's medication, sensitivity to codeine. All of those can be written later. No, family history is very important because that's the reason this procedure is being performed. So we'll put it in the introduction problem. Yeah. Okay. So yes, this letter can be written both in chronological and in hierarchical manner. We'll discuss both the organizations on screen, and then if there be questions, you can ask me. For all the people who opted for chronological, you are going to help me here. In this organization, we write the introduction first. After that, what do we write?
Past
Excuse me, ma'am.
history or social history.
Family history.
Past history or social history. There is nothing relevant in social history, but the family history. So,
Family history.
anything else that happened in the past?
Medications and allergies, ma'am.
No. Before that? The patient's bowel cancer scan test.
Test is first.
Positive and patient wants colonoscopy.
Right. So, bowel cancers can also happen before the patient's visit to you, and the family
Yes,
history also
ma'am.
happen before the patient's visit to you. Then what will we write about?
Present
Again.
history.
Then
Present condition.
medications.
You have done two things for the patient. What are they?
Assessment and nursing management.
Right. So you will write about the assessment of the patient. What did you assess in patient's condition?
Changes
But that are irrelevant.
vowel patterns.
The pathology tests, and you also found out the information about what did you find about the patient on assessment?
Ma'am, changing bowel pattern. Ma'am,
Okay.
he is sensitive to codeine.
Right, the sensitivity, and
So the alert band is attached.
right, so the sensitivity and the medicines, all of that information you found when you assessed the patient today, when you had a conversation with the patient today. Then what else did you do for the patient?
Ma'am, procedure is explained.
Right, the management, which included the explanation of the procedure. What else?
Brochure.
Diet preparation.
That includes, yeah, diet and bowel preparation. Plus the pamphlet or the leaflet that is given. Anything else that you managed for the patient?
Ma'am, alert band with the letter.
That we'll add with sensitivity to codeine, no? That
Fine,
he's
ma'am.
sensitive to codeine, so an alert band is attached. Yeah, we'll write it there itself. We'll not make a separate thing for it. And then after this, what do we write? Is there any request?
Request paragraph.
He will be
Follow up
reviewed.
paragraph, follow up.
There is no request.
Nurse and
Just the
doctor after
information
procedure.
about the review that would happen after the procedure to decide the further
And
course of
further
action.
counseling on that depends upon the results of the colonoscopy.
Absolutely. So there is no request in this case. Yes, there is something that's to be done in the future, and that is the counseling that you are going to do for the patient after the procedure is performed. So this is one way of putting the information. Have a look at it. If there is anything that's not clear, you can raise your hands and we can discuss. No questions now. Okay. Then, Ruben, you are the only one who mentioned hierarchical, so I'll need your help now. All the chronological people, please be on mute. We first write the
Excuse me, ma'am.
introduction. Now, Mandeep, I'll take your question later. Let's first discuss this. So, in hierarchical, Ruben, we'll first write the introduction. What do we write after that?
The assessment and the pathological findings.
Okay.
And then from there, we are going to look at the management.
Right.
And the explanation. Yes. And the explanation.
Right. Since in the assessment, we are just going to write about the pathology test, we can write the management in the same paragraph, as we are not writing about the medications here. We'll be writing it later as it's less relevant. So we'll include the management, that is explanation of the procedure. Then what do we write, Ruben?
Then we'll talk about the family history. The family history. And then from there, from family history, we can also add on the medications.
But the family history is the reason why the patients want colon cancer test to be done. So that's very most important information in this case. So that could be after the introduction, Ruben. So we'll first write about the family history in this case as well, along with the information about the patient's screen test.
Yes, screen test.
At the end, we are going to write about the medicines, the information about the sensitivity, and the information about the counseling that would be done in the future, and then the closing. Because, so if you see on the right hand side of the board, your right hand side, we have written the letter hierarchically, which means the most relevant information for the recipient in order to perform the procedure has been written first, and the least relevant information later. And how did we decide what is more important, what is less important? We decided it according to the writing task, because the writing task mentions that we have to write and give the details about the patient assessment and management. So we are writing about the assessment and management first, and all other findings that we have found about the patient later. Now, in both the organizations, where do we put the height and weight of the patient?
Ma'am, that's my question.
Oh, okay. Right. So that's
I mean,
my question
assessment.
and Indeed's question. Indeed's question. Where do Ruben mute?
In assessment, ma'am.
In assessment, okay, right. So one way of writing the height and weight is that you put that information in the assessment, that his height. No, muting is not the solution. Keeping your lips closed is the solution. So one way of putting that information is that you write it in the assessment, that the patient's height is this and weight is this, because this is what you found when you assess the patient's condition. Another way is that when you're writing in the introduction the patient's name, in brackets itself, you can write the patient's height and weight. I'll show you how we can do it. Before we move on to the introduction, are both the organizations clear?
Yes, ma'am.
Yes, ma'am.
Will you be able to put this information into the paragraphs? Yeah, I can see the confidence, you girls and guys. Why are you not confident? The problem
Sentence
is
formation.
so how will you improve it, Mandeep? Will you continue to have this problem all your life?
No,
ma'am. So first we need to have the confidence that yes, we can put the information. Only then will you be okay. Let's say if you first doubt yourself, do you think anyone is going to trust you if you doubt yourself? No.
No, ma'am.
So first, you need to believe in yourself that yes, you can make the sentences. If there be errors, let there be errors. The errors can obviously be rectified. But obviously, you can all frame good sentences. There is no problem in that. So you will be able to do that is the first thing that you need to know. So will you be able to put this information into paragraphs?
Yes, ma'am.
Yes, ma'am.
Better.
Yes,
Right.
ma'am.
Very good. Now let's discuss the introduction. Was there any admission? Is there any discharge happening in today's set of
No,
cases?
ma'am.
No, no, ma'am.
So the patient was not admitted to your facility. The patient is not getting discharged. So when there is no admission and discharge, we answer 3 questions in the introduction. Number 1, who is the patient?
The
And who is the patient in this?
purpose, Mr. Michael White.
Mr. Michael White.
Or
Mr.
Mr. White.
because the patient is an adult patient, we can use their second name and the title as well. The
Yes,
second
ma'am.
question, what's the purpose of writing the letter? What is it?
To introduce the patient and give information.
Very good. Either you can write to introduce the patient or to inform about the patient, whichever way you want to write, it's fine. Third, why does the patient need a referral? Why is this information to be given?
Ma'am, because his colonoscopy is
Patient is
scheduled.
going to undergo colonoscopy on 10th of June 2018.
June
He has
As
been
his-
scheduled for
at their
colonoscopy.
facility.
Very good. As his colonoscopy is scheduled at your facility, because we are writing to the recipient facility on which date?
On 10th of
10th
June.
of June 2018.
2018.
Right. So we are writing to introduce the patient, or we are writing to inform about the patient as the colonoscopy of this patient is scheduled at the recipient's facility on 10th. Do you think when the recipient reads this paragraph, they would be able to understand why they have received the letter?
No, ma'am.
No, ma'am.
Mandeep says no. Why no?
Ma'am, as we know about why it is underwent a colonoscopy, as he has worried about his family history of colon
Need
cancer.
reason, ma'am.
So
Reason.
you are writing to the recipient to inform about this patient, right? But you are giving this information because his colonoscopy is scheduled at this facility. Is it important for the purpose, or is it important for the recipient to know in the first paragraph why the colonoscopy is scheduled?
Yes, ma'am.
Yes, ma'am. Scanner results.
It's not. The answer is no, it's not. The purpose without the information about the scan result and the history is also fine. It is well established. The recipient will have enough clarity about what's the purpose and why does the patient need, why is the recipient receiving that letter. So the establishment is okay. However, if you are confused, because on the test date, yes, like Mandeep and Seema, you can have the confusion. So in that case, if you write the family history and the bowel cancer in the introduction, will your purpose paragraph be wrong? The answer is no. Because both of those pieces of information are directly related to the purpose. Even if you write it as the last sentence of the introduction, it would be okay. But primarily on reading this introduction, the recipient will be able to provide care to the patient or will have an overview or an idea about the patient's situation. Right. Yes, so me, your question.
Ma'am, in this third line, colonoscopy is scheduled. So, like, if I write has been scheduled, then
Now, that would be wrong, but this is a rule for present simple tense that whenever you're talking about some timetable or some schedule, we use is. For example, let's say when Ahana sends the classroom schedule. So if she writes the complete sentence, she would say, this is the schedule for tomorrow. Although it is for tomorrow, this is the schedule. Whenever we talk about, let's say, the writing class. So tomorrow you have a skills lesson on writing, you will have it as the first class. So I would say, tomorrow your writing class is is at 10 a.m., right? So whenever you're talking about schedules, you use present simple tense. However, has been is also fine in this case because the action has already happened.
Okay, thank you, ma'am.
You're welcome. Yes, Simran?
Ma'am, here the height and weight is to be added.
Yeah, thank you for reminding. So another way of writing the height and weight, one was in the assessment paragraph, another way is this. What is the height?
175 centimeter.
And what are the spellings of height?
AGIGHT.
HEIGHT.
HEI or IE?
EI.
HEIGHT.
Whatever it is, and then yeah, you can write and then the weight. Whatever it is, and then you close. This is also another way that you can write the height and weight of the patient. Both are correct.
Okay.
Yeah. Right. Anything else?
Ma'am,
Yes, Muskan?
ma'am, what about the age?
Age will be there in the subject line, no, Muskan, not in the introduction. In the
Okay,
RE
ma'am.
line, yeah. Any questions about the organization in the introduction? No? Then give me a second. There needs to be some message related to your classes for me. I'll just check. Okay, no, we can continue the class. All right, then let's write the letter as much as possible in this class. Let's begin with the introduction. I will give you all 3 minutes of time to write the introduction, and then I would listen to the paragraphs that you've written so that we can see if there be any grammar errors in your writing and we can correct it. So your 3 minutes to write the introduction begin now. Please write it. Write the introductory paragraph, everyone. Hi, Ma. Have we all written the introduction?
Yes, ma'am.
Yes, ma'am.
Meantime, I have written the salutation for you. So you can have, I mean, the layout for you. So you can probably have a look at it. And if there be anything that's not clear, you can raise your hands and you can ask me. This is the layout that you're going to have for the letter on the top. Right. That now that you've written the introduction, I'd like to listen to some of these. Parmeet, who is sitting behind you? Sheetal, can you read your introduction, please? Have you written as his condition? No, only as his. Yeah. Otherwise, it's yeah. It makes sense. Yeah, this is fine. I'm sorry, I don't know the name of the Sardarji who is in Mohali. Sardarji, your name, please. Palvinder, can you read your introduction, please? Mm-hmm. 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 Hmm. वही तो लिखना था ना. The introduction, the first paragraph is what I wanted. That's okay. You can write it now. Parveen, who is sitting by your side? Parveen के पास कौन बैठे है? Parveen, not Parmeet. Who is sitting beside you? Hanji Mandeep, please read yours. Hmm. Is the word patient allowed in OET writing? So wherever you've written patient, Mandeep, you will lose marks. So remove patient. Instead, you can use he or you can use Mr. White. And he is being referred to you. Present continuous tense will have the helping verb is. Okay. I forgot your name. Amrit. Amrit, read yours. Amrit is not written only. Poonam, read yours. If you don't write people, how will I know? Seema, okay, read.
Ma'am, I am writing this letter to refer Mr. White, who is exhibited sign and symptom consistent with colon cancer, and he is scheduled to undergo colonoscopy in your hospital on the 10/6/2018, and he is being referred to you for confirmed diagnosis.
No. Otherwise, it's fine. He's being referred to you to confirm the diagnosis. You have not made any provisional diagnosis yet. And he is not coming with all the signs and symptoms. Everyone and anyone can have bowel issues, no? So that does not mean that the patient has cancer. So signs and symptoms also writing that would be a little off the track. So I would not suggest that you write that. And the patient is not being sent for the confirmation of diagnosis because you don't have any probable diagnosis yet. So he is being referred to you for colonoscopy only, nothing else.
Okay, ma'am. Thank you.
No problem. Sazia, can you read yours? No, she's not there. Ravina, can you read yours?
Yes, ma'am.
Yes, please.
I'm writing to introduce Mr. White, who is scheduled for colonoscopy in your facility on 10th June 2018, full stop. So, comma, he's being referred to you.
Makes sense. But who is scheduled? Can you schedule the patient?
No, ma'am.
No, you can schedule the appointment or you can schedule the surgery, but not the patient. So who is scheduled is wrong. Whose colonoscopy is scheduled at your facility, not who is scheduled.
Who's?
Yeah.
Okay, ma'am.
All those who are
Thank
raising
you.
their hand, let me choose the people. Mamta, can you read yours?
I am writing to introduce Mr. White, comma, weight is 175 centimeter and sorry, height is 175 centimeter, weight is 88 kg, comma, as his colonoscopy is scheduled at your facility on 10/6/28.
Either you write whose weight is, or you write weight, whatever, height, whatever in brackets. You cannot write it in commas. If you want to write it in commas, Mamta, you'll have to write whose height is, whose weight is.
Okay, ma'am.
Yeah, otherwise that would be wrong. Amandeep online, can you read yours? No, you're not there. Keba, if I can request you to read.
Yes, ma'am. I am writing to inform you about Mr. White. Height in brackets and weight in brackets. As his colonoscopy is scheduled at your facility on 10th.
Makes
That
sense.
is tomorrow. Yeah.
No, you don't have to write that is next week. This is fine. On 10th is fine. Right. Now, my question is for everyone else. Kiran, I'll probably give you a chance the next time. My question is for everyone now. How many of you are writing this letter chronologically? Can you raise your hands? Okay. And how many of you are writing hierarchically? And the others who have not raised their hand, are you not writing the letter? What's the plan? Chronologically. So if you're writing chronologically or hierarchically, what will be there in the next paragraph?
Ma'am, family history and
Family history and
contact
test.
of his family history.
You are going to write about the family
Family
history
history and test.
the positives can test. So we still have time. Do you want to write the paragraphs now or do you want to leave?
Ma'am, there is one question, ma'am.
I'll answer your question, Manorma. Just a second, let me confirm with everyone. Do you plan to continue writing for the next 15 minutes or do you want to leave? You want to leave? You may.
Continue, ma'am.
If you want to leave, you may.
We will write.
For all those who can continue, yes, you may. For all those who want to leave, please do leave because I know it's getting very late and it's very foggy. So yes, you may leave. For all the offline students, if you're feeling that you're getting late, please do leave. There is nothing new that I'm going to do, but make sure that you write the letter. Yes, Manorma, your question now.
Ma'am, is that okay to write in the introductory para that ma'am, I wrote he is being transferred under your care.
Under your care is not a very good phrase, Manorma. He's being transferred to your care can be written, not under your care.
Okay, ma'am.
Yeah. Yes,
Thank you,
Ruben,
ma'am.
your question, please. No problem. Ruben, your question. You're on mute.
Yes, ma'am. I just wanted to inquire, like I wrote in the introduction, the point where I said he has an appointment of colonoscopy on the 10th June 2018. Is that okay?
He has an appointment for colonoscopy at your facility on 10th. Please add this phrase at your facility.
Yeah, I think so.
Yeah, do add that phrase. Otherwise, yes, it's okay.
Okay, thank you very much.
You're welcome. Just a second, Ramveer, I'll come to you after Kulkiran. Kulkiran, go ahead with your question.
Yes, ma'am. Ma'am, I want to ask, like in the introduction, can I write like this? As he is scheduled to have a colonoscopy at your facility on 10/6/2018.
Yes, you may.
Okay. Thank you, ma'am.
Others, you can continue writing the next paragraphs, and while writing that, if you're facing questions, if you're having problems, come to me, I'm here. Yes, Kiran Meerwal, your question.
Ma'am, in introduction, height and weight is necessary to write in.
Either in the introduction or in the assessment paragraph, wherever you want, you may write, but it is necessary to include it. Akanksha, your question.
Ma'am, the information about that he had this positive colon cancer scan, can this be included in the introductory paragraph?
Yes, you may. As I mentioned, you may do that because that's the reason why he wants the colonoscopy. It's directly related to the purpose, but it's not needed for the purpose.
Okay, thank you.
Yeah. Ramveer, your question, please. I'll take a look at it. Shubham, give me some time. Ramveer, your question.
Ma'am, I wanted to read mine also.
Okay.
Whether it is right. I'm writing this letter to inform about Mr. White, who requires colonoscopy, which is scheduled on 10/6/2018 at your facility.
Which is scheduled at your facility on 10th. The date or the time will always come at the end.
Okay. Okay. And she will be transferred on 10th.
No, she will not be transferred. He may himself go there. So we don't have to write about the transfer yet.
So, I mean, I'm confused about what after this actually. I mentioned the date and hospital. So,
nothing. Full stop.
Nothing.
You move to the next paragraph.
Okay, that's fine.
Shubham says, I'm writing this letter to introduce Mr. Michael White. White's W in capital, whose weight is and height are. Weight and height, two things. So weight and height are 175 and 80 kgs respectively, comma, as his colonoscopy scheduled at your facility on 10th, not full stop as his colonoscopy, because as his colonoscopy, that part is not a complete sentence. So you cannot write it after a full stop. You'll have to put a comma and then write.
Ma'am,
Yes, Ramveer?
signpost, regarding the signpost in first, like I'm writing in a chrono. So first signpost I use in socially or medically?
No, that would not have any signposting. You will directly write his family history because that would automatically say that you're talking about that. And then in the next paragraph, if you're writing chronologically, so you will write during his visit today, whatever you did, and then you will write following the procedure, he will have a counseling session with us.
Okay, thank you.
Yes. Yes, Kiran, your question.
No, ma'am, I will
do what?
मैम मैंने ये लिख लिया है in first paragraph in writing. I will share with you. I am writing to refer Mr. Wright. His height and weight are 175 centimeter and 80 kg. He is scheduled for colonoscopy on 10 June 2018. Mr. Wright has family history of colon cancer and he has positive result of colon cancer screen test.
All of these pieces of information are okay, but the sentences are not connected. There is no connection between one sentence and the other. So I'm writing to refer or to introduce Mr. whatever, whose height is so and weight is so, comma, as his colonoscopy is scheduled at your facility on so and so date. Then you can write Mr. White's family history.
Okay.
Yeah, the sentences need to be connected. The ideas that you present in your letter, they always need to be connected. Any other question that anyone might have for me? No questions?
Ma'am,
Okay.
what we
Jaspreet.
instead of review, what we are other words used in last paragraph, like review, on review, or like at the starting. Okay.
Is consultation? Yes, that can be written.
Okay, thank you.
You're welcome. All right, then you can continue writing the letter. If the next class is not scheduled, or if the next one is scheduled, you can attend that and complete this letter. I'll send a similar task for your follow-up where you're writing to a surgical nurse. Will you be able to write a letter to a surgical nurse if you get it in the examination now?
Yes, ma'am.
Yes, ma'am.
Good, good. If there be any questions, as I started the class with this, I'll also end the class with this. If there be any help that you need from me, do drop me a message. I'd love to help you. Thank you very much for attending the
Hello,
class.
Thank you, ma'am.
I'll see you all tomorrow for the skills lesson. Bye-bye.
Thank you, ma'am.
Thank you, ma'am.